My patients have been getting fatter and sicker over the last few decades, and in particular, we're starting to see diabetes out of control, and that changes everything. I used to see the occasional person who needed diabetic foot ulcer management and needing an amputation, and it started becoming virtually weekly. When you come into a clinic and there's patients with, with rotting flesh, and it is rotting flesh, and it smells bad, it looks bad, and all you're doing is just trimming off a little bit of foot. It starts with a toe, starts with an ulcer, then it moves up the foot, and sometimes you get to a point after doing 2 or 3 operations, it's been going a couple of months, and then the decision is you've actually got to chop that leg off. There's something which really upsets me, and that's when you actually amputate someone's limb, there's a sound of actually dropping that leg into a bucket. I don't want anyone to hear that, that noise. It's just, it's just sickening. I started talking to my patients about reducing sugar, and the benefits were immediate.
Not only would the people's fatty liver disease get better, not only would all of their blood numbers get better, but in fact, he would not have to end up chopping off a foot or a leg.
I then went to the hospital dietitians and said, hang on, this is really exciting, this stuff about sugar. Started talking about it to the staff, and then I started implementing a sugar reduction for my patients, only to find out that I was starting to tread on some big toes. The dietitians then started kicking up a stink about that, involving their parent organisation, the Dietitians Association of Australia, who started becoming involved in pressuring the hospital into silencing me.
We received evidence in Sydney from a medical practitioner in Tasmania, Dr. Gary Fettke. He gave the evidence to the committee in the morning of our hearing in Sydney. 3 hours later, he received an official caution from AHPRA.
The first time I heard the story, I just thought it was a joke.
The board's actual statement requires that doctors double-check that their personal beliefs don't compromise care, that they don't put their commercial interest in front of patients, and lastly, doctors should provide appropriate dietary advice.
Ultimately, the medical board made a ruling that I am now the only doctor, as far as we know in the world, to be banned from advising his patients to reduce their sugar and junk food intake. And if that sounds crazy, then that's what it is.
We recognise that the being subject to the notifications process for a practitioner can be an extraordinarily stressful thing, because there are pretty serious issues at stake ultimately in terms of their practice of their profession. And
their reputation.
And their reputation. And despite the fact that we are not punitive in our focus, we are protective in our focus, so our mandate is a public protection focus, we understand and appreciate that it may not feel like that for the practitioner involved in the process.
For a long time, I couldn't actually work out why there was anything actually against what I was talking about. Everything about reducing sugar and carbohydrate is basic biochemistry. It's in the first 100 pages of textbooks. There's nothing extreme about it. Once you see the results of reducing sugar and carbs, particularly in diabetes, you can't unsee them.